When we look at operations manual in practice, how well do cruise ships live by that document?
That's a good question. The operations manual, all 300 and I don't know, 50 pages of it is as comprehensive as it gets. But implementation, as I said before, that is embracing the high standards of public health and creating a positive public health culture are the keys to success. You can have a top-notch manual on the shelf, but it doesn't mean much if, for example, the risk factors that cause food or waterborne illness are not addressed and there is a lack of active managerial control on board.
Exactly, Captain Thomas. I performed audits where raw animal products were stored above ready-to-eat items. That's a textbook case of cross-contamination. That's a 3-point violation under the section 7.3.3.2. It's classified as a high-risk issue. I've also seen time control plans missing or incorrectly implemented at self-service buffet. That's another critical 5 points deduction under section 7.3.5.3.5. Since food held in the temperature danger zone pose a real risk of outbreak. And in some venues, there was no proper consumer advisory posted, where raw or undercooked items like sushi or rare steaks, ex-cooked to order, were served. That's a 5-point violation under section 7.3.6.1.2. This may seem like simple oversight, but under VSP scoring, they signal potential for real harm and significant impact to the ship public health grade.
Yes, and sometimes it's not about a lack of caring, but a lack of knowledge and or understanding. Take water management, for example. Section 5.4 talks about backflow prevention, but if the team doesn't understand how a vacuum breaker works or why it even matters, you have a lack of training. Fundamentally speaking, as laid out in the operations manual, knowledge plus performance of duties equals active managerial control. That brings us back to the gold standard we've been talking about.